Hi, thanks for taking time to watch this video. I'm Dr. Marty Sterrett, Chief Medical Information Officer and ED Staff Specialist at Northern Sydney Local Health District. And today I'm going to be speaking about how Dragon Medical Solutions is helping New South Wales clinicians deliver high-quality clinical documentation. Using Dragon Medical, clinicians can dictate, insert templates, edit and complete clinical documentation. It's also easy to use speech to open your favorite websites if you need clinical decision support. Clinicians are able to dictate progress notes, assessments, procedures, and plans directly into the EMR. They are able to benefit from a very high level of accuracy in dictation across more than 90 specialty and subspecialty medical vocabularies. Single user profiles are created that can be carried to any PC on the network that has Dragon installed via the central server. User profiles are optimized on a regular basis to learn and improve speech recognition accuracy over time. It allows the convenience of using multiple input devices including a USB headset, digital voice recorder, and Nuance's own plug-and-play microphone handset. Executives can gain a better understanding of the return on investment for the speech recognition system because of the enhanced reporting capabilities. At Northern Sydney LHD, we've been encouraged by the adoption of Dragon Medical at all 5 hospitals and several of our outpatient facilities. We're keen to inform and promote the solution statewide through New South Wales Health to make it available to other clinicians who can then enjoy its many benefits. In this video, I will use 2 examples of Dragon Medical to show you how it can significantly improve a clinician's experience. The first is within the EMR, and the second within Dragon's own dictation box. Let's begin. In this example, I'll show you how you can enter a Dragon note into the EMR using a complex template on a difficult patient. I'll first open up ED Assessment and make sure I have a cursor, and then I can call up my template with the simple command Marty H&P template. Dragon now takes me to the top of the document where I can begin dictating and using my microphone handset to move through the different variable text fields. Chest pain, shortness of breath. This patient presents with severe chest pain which occurred while he was running on the beach today, full stop. He also describes shortness of breath and dizziness with the pain, full stop. The pain is crampy, sharp, and radiates into the left jaw and arm, full stop. The patient was brought to hospital by ambulance and is now pain-free after having received GTN en route, full stop. I'll now dictate his past medical history and continue through the document. Hypertension, new line. Hypercholesterolemia, new line. Diabetes. Atenolol, new line. Atorvastatin. Penicillin, which causes a rash. The patient's father died of an acute MI at the age of 45, Patient's mother is still living but has hypertension in her 80s. Smokes 2 packs of cigarettes daily, new line. Rare alcohol use. As above, also note that the patient reports shortness of breath on exertion and has noticed going up flights of stairs causes him to be more winded than usual. In the examination, I have a completed exam and the usual statements that I would do, and in this situation I'll leave a lot of those the same in their variable text fields, but I'll change a few to show you how that works. Blood pressure 160/90, heart rate 85, respiratory rate 16, O2 saturations 94% on room air. Delete next 2 lines. Crackles in both bases, good air entry throughout. Regular in rate and rhythm with a 2/6 systolic ejection murmur. Normal pulses, comma, no cyanosis, comma, trace pitting edema to the knees. ECG demonstrates ST flattening in the inferior leads, comma, no reciprocal changes. Insert after impression. New line. Chest pain in a patient with multiple cardiac risk factors. This is a good part of the document to show you where I can insert a template within a template. And so I'm going to put my usual cardiac plan inside of this one. Cardiac plan. Delete line. Now I'd like to leave the rest of the document as it is, except for getting rid of the brackets around my variable text fields, and so I'm going to give Dragon the final command, accept defaults, in which case it will go through the document and it will remove all of the brackets to make it a nice clean presentation. And so now I've got a thorough document, thoroughly described how this patient presented, why he presented, with a clear plan and a clear diagnosis for this patient, or at least a clear impression. And now I'll sign and move on to my next patient. In this demonstration, I'm going to use Dragon's dictation box to show you how I can complete a history and exam on an ankle sprain injury quite quickly with Dragon. I have a template that allows me to say whether I'm treating a patient with a left ankle, right ankle, or both ankle injury. Left ankle sprain. Playing basketball, full stop. The patient unfortunately also has a mild head injury after falling, full stop. I can add to the narrative on this anywhere I want to, and in this patient's particular case I want to mention that he's allergic to ibuprofen. New line, past medical history, colon, non-contributory new line, allergies to medications, colon, ibuprofen which causes a rash, full stop. I can now move to the next variable text field by using my handset, and that takes me to an area where I can then discuss whether or not this patient has knee symptoms with the ankle sprain. If I agree with what it says in that variable text field, I can leave it there and move on to the next one, which I'll do now, and change this variable text field to final report pending, GP please follow up. I'll now complete the treatment plan. Ibuprofen and paracetamol. Crutches and advice to toe touch weight bear for the next 4 to 5 days. General practitioner. When I'm finished with the dictation, I will now get rid of the brackets, which I don't want in my documentation, but by simply pressing a button on the handset. If I'd seen a patient with an injury to the other side, I would have just changed the way I've asked for the command. New paragraph. Right ankle sprain. And you can see now that Dragon has changed that to a right ankle injury. I've now easily completed that dictation, and I can now move on to what else I have to do.